This year, as the previous one, has been severely impacted by the COVID-19 pandemic, which caused delays to our program's implementation. SFH Rwanda programs are community-based interventions which need our staff to move from offices to community settings, and COVID prevention restrictions did not allow such movements. However, SFH's great collaboration with its line ministry, Ministry of Health, and local government enabled us to implement the Q1 2021 work plan as it was planned.
This was a time to think about new strategies, new innovation, new approaches to enable us to implement the planned activities.
Let's just talk about the program implementation progress during this period. Under Reproductive Maternal and Neonatal Child Health Program, all planned activities were successfully implemented.
A program like Ingobyi Activity, which aims to provide integrated maternal child health, family planning and malaria prevention, social behavior change communication messages, as well as services to those in hard-to-reach area who really need such information and services, was very important to our program, and it is a core. So this would not have happened in such situation. Using mass media channels to reach our target audience was one of the innovations we used. And through this, we have seen the impact in getting good numbers of people adopting family planning methods. We have had testimonies of male partners supporting their wives on family planning, and even themselves adopting vasectomy as a family planning methods.
To address issues around adolescent and sexual reproductive health, teen pregnancy and HIV prevention, 290 secondary school teachers and health center focal points in Gicumbi and Rubavu have been trained on ASRH to support the program's implementation. Cyber Rwanda program. Baseline data collection is ongoing in Rwamagana and Gasabo, where a total of 2,800 students were interviewed regarding their understanding of various sexual reproductive health topics. Before kicking off the 2-year implementation of the project, all 8 implementation districts and 60 schools must undergo the baseline survey, after which 40 implementation schools will receive the CR intervention. Also conducted was the Content Validation Online Workshop that brought together individuals that belong to national TWGs. Enabel program. We have started the implementation, where inception meetings to engage local leaders were conducted in all 7 targeted districts. The SBC strategy is being developed. Baseline survey is ongoing and CAP soon to start. This quarter, SFH was able to hand over 10 second-generation health posts in different districts. In addition, we had a fruitful visit by the Ministry of Health, who visited the health post located in Bugesera and indeed appreciated the work done.
First, I want to thank SFH for this good job. They invested heavily in this health facility with adequate infrastructure and equipment. It's well done. Equipment are nice and are strong enough. So I applaud really what they did.
A learning visit to Health Post by UNICEF Rwanda team was another partnership for the creation of more HP. Despite the COVID-19 outbreak, the following were achieved under Malaria SBC program. Provincial inception meetings with local leaders, district inception meetings that engaged all districts and sectors' focal points, technical orientation meetings with CHWs, where a total of 118 meetings were conducted with 5,599 participants.
CDC program is targeting key populations, including female sex workers and the MSM, male who have sex with men. And the key results in Q1 or Q1, October-December 2020, we have achieved all indicators. DoD program is a program implemented by RDF medical staff, and the DoD means Department of Defense, yes. We have an award from US government to support RDF in fighting against HIV among RDF members.
In the efforts of fighting the spread of COVID-19, SFH Rwanda, with its partners, continue providing technical and financial support to the government through the Ministry of Health and RBC to raise awareness, community engagement, and education. A 3-month intervention for COVID-19 prevention and control that aimed at enhancing the capacity of 1,000 CHWs from 10 districts located along the borders, trained them so that they support in the COVID-19 pandemic through home-based care for active cases and contact tracing at community level. 1,000 CHWs trained and provided with PPE, thermometers, face masks, and hand sanitizers to protect themselves and others during home visits. 77,447 HHs were visited by the trained CHWs. 374 suspect cases were monitored by the trained CHWs for a period of 14 days. 226 cases have been monitored by the CHWs and all recovered.
So we are still coping with the COVID because it's still there. We are still trying as much as possible, and we believe with a team working and leadership and good management, we shall achieve our goal as set in our strategic plan.